Hello, I'm Bruce Harders, and this is Voices in the Village. Today we have with us Amy Osman Cook. She is the owner and director of the Skilled Nursing Association of Providers. Amy, thanks for coming by and welcome to Voices in the Village.
Thank you so much for having me, Bruce. It's really a pleasure to be here.
Great. This is going to be part one of a two-part series that we're going to be doing. This discussion will be in the world of nursing and medical things and the overall world of healthcare. Our next discussion will be on the world of business. So, Amy, in terms of what's going on in the medical industry, is there something new or hot that's going on that I don't know about?
Well, you know, there is something very interesting that just came out. It was a study by Dr. Mark Fisher at UCI. And UCI is, as you know, one of the premier health companies in the world.
For sure.
Medical facilities. And so a lot of research goes on there. And they found a very interesting fact about strokes. So Dr. Fisher found out that early care given for high blood pressure and cholesterol, as well as cardiac care, could help prevent strokes in 75% of cases.
That is mind-boggling.
It's mind-boggling. And it may not be able to prevent it entirely, but some prevention could have been done in 75% of cases.
Right.
You know, this is really near and dear to my heart because my grandma, she died following 2-year paralysis after a stroke. And it was really, really difficult for her. It was difficult for our whole family. It was really difficult to watch that happen. And she was almost completely paralyzed. And so, you know, I always think about that and what could have been done for her.
Right.
And how could her life have been improved?
Right.
And so that's one of the reasons that I founded the Association of Skilled Nursing Providers, was to help my grandparents and my parents find good alternatives as they age.
Well, it wasn't too many years ago and people lived in small towns and had no access to a large hospital or large medical care, but with all these regional hospitals and everything, it's helped a lot to give the best of care to people all over the place. And this sounds sort of like there's a phrase out there called aging care. What exactly is aging care?
Well, aging care refers to a suite of services that benefit primarily people ages 65 and up, those who qualify for Medicare. It can benefit people earlier or later, but around that time people start needing some specific services. It could be anything from home care to home health, to skilled nursing care, to assisted living care. All of these things kind of are in a continuum of care that we like to think of as aging care.
And of course, that ties in with the tremendous expansion of healthcare in the United States and all over the world. What kind of expansions do you see out there?
Well, it's interesting because right now, about 12% of the population in the United States is 65 or over. By 2050, that is going to grow to 20% of the population.
That's huge.
That's a huge population with a lot of services that are going to be needed. And I want to make sure that my parents and myself as I age, that we are able to provide great care for everyone who needs it.
That's right. It's so important as you age that you can still have a high quality of life. That's really what it's all about.
It is what it's all about, and I think that the perspective is very wise as well, in that we're talking about, you know, regular people whose minds are alert, who want to be, you know, live to the fullest extent of their lives, and maybe they, you know, have a stroke or have some medical conditions that they need to take care of, but their quality of life needs to be preserved.
Absolutely. Well, within the context of everything growing and getting bigger and ever, I have noticed personally that the nursing profession has changed a lot over the years. There are all kinds of titles and jobs that it used to be just a nurse you would be encountering, but today there's all kinds, isn't there?
That's right. There are all kinds of nurses. My sister, for example, is a geriatric nurse. So she takes care of people who are aging. There are another really good friend of mine is a physician's assistant. That is not a nurse in and of itself, but there's also a this type of nurse that my friend is able to prescribe medication, and she's able to act kind of like a physician's assistant and basically operate her own business under the license of an MD.
Well, I noticed that there are nurses today that are performing what we used to think would be sheer doctor services.
That's right. That's right. You can go in and you can see someone and not even see the doctor and receive a really great quality of care.
That's right. Especially sometimes if something's come up and the doctor isn't available, which is often if you don't have an appointment. Now you can really sit down with a very qualified nurse who's been trained to do a lot of things the doctor used to do and get some really fine service.
That's right. That's exactly right. It just goes to show that in medicine, there is a growing need. And actually, there is a growing need for nurses. There is a shortage of nurses right now. So hopefully, you know, the nursing schools will pay attention and enroll more students, and we'll have more nurses.
Right. Well, I guess the healthcare industry is one of those that doesn't go through any depression. So there's seems to be always a lot of work for men and women in that field.
That's right. There is a huge need and a growing need.
Well, one of the things that I've always found interesting, fortunately or unfortunately in my career, I've moved around a lot and had to establish a new doctor. And I found out that there's a lot of different primary care physicians out there with different titles and different backgrounds. Could you talk about that a little bit?
Sure, and it also speaks to this study a little bit as well. You know, with early intervention, being able to influence the number of strokes that could have been prevented, it's really important to find out what kind of care you are eligible for as per your health plan, and what kind is going to be the best. So like, how do you pick a good doctor? How do you pick a good physician's assistant? How do you pick a great nurse? And so those types of things I think are really important. Now, as far as different types of doctors, there's a primary care physician.
Right.
And then there's also an internal medicine specialist.
Right.
And so I know that you really like the internal medicine.
Right.
Doctors.
I know two of the categories that I'm familiar with. One is internal medicine, and I've always been lucky enough to find a good internal medicine as my primary physician. But I also know there's a field called a family practice or family doctor.
That's right.
What is that about?
Well, a lot of it depends on how you specialize. So when you're looking for a good doctor, make sure that they're board certified. So they could be board certified in family practice, or they could be board certified in internal medicine. But they both qualify as primary care physicians.
I see. Well, I know that there are a lot of people out there that sometimes these doctors will be specialists in two areas. They might be a cardiac guy who's also an internal guy, and all that. That must take an awful lot of time and schooling to get to that point, doesn't it?
It really does. I have a friend who is a pediatric cardiologist. So I think the way that it went was he got his internal medicine certification, then he got his cardiac certification, then he got his pediatric cardiac certification. So a lot of these guys have been to school for, 12 and more years.
And then depending on what you have, in the world of cancer, it's an oncologist that really didn't exist per se for a long, long time.
Yes. So, many women, many men have spent their lives being able to learn how to provide good quality care.
Absolutely.
Wonderful.
Absolutely. One of the things that I've always believed in having a doctor is to make sure that I feel like I'm a full partner with that doctor. I would call it managing my doctor. Do you have any thoughts about the pluses and minuses with a philosophy of managing your doctor?
I think that is so brilliant the way that you said that, and it definitely needs to be done. A good doctor will encourage you to ask questions and to manage them per se. The way that these health plans are is that many doctors have to see 80, 100 patients per day, which is almost impossible. And so what they want is for you to take some of the responsibility for your own health care and say, you know what, you're helping me, but I'm primarily in charge of my own health.
Right.
And so things, the way that you said it was perfect, to manage them, to ask them questions, to do whatever research you can, to follow the guidelines that they give you as well. I have some friends who are physicians who talk about, how frustrating it is when their patients don't follow their doctor's orders and then they end up in the hospital.
That's right.
I think that's very important. But then also, ones that they need to ask questions, they need to understand why they need to take the meds. And sometimes, because these physicians are pushed so hard to see so many patients, sometimes they don't spend the time that they should. So make sure that you do that.
Well, I know that in the field of cancer, which unfortunately has grown tremendously, although a doctor I talked to one time said it goes all the way back to the Egyptians when they found out these people, had cancer. But what it seems to me, the more specialized medicine is today, the less likely there is for the patient to ask a lot of questions. I mean, they get in, like in a situation with cancer, with people get so down and upset and everything, they start looking at their doctor as sort of a god. And, they're like anything else, there are good oncologists and there are not so good oncologists. And unless they really dig down and say, well, why are you doing that? Or isn't there a clinical trial somewhere or whatever? My thought is talking to various people who have had cancer and dealing with cancer, this is a real problem out there, that there's a lot of bad work being done out there just because the patient hasn't been pushing the doctor.
Yeah, I agree. I think that that's a really important concern. And that's actually one reason that I founded the Association of Skilled Nursing Providers. I'm committed to helping people find the material they need and the education that they need to make informed choices. And so one thing that we have done, which I'm very excited about, is we have a live chat module up on our website. So if you go to skillednursingproviders.org, you can ask any question that you want, and we're not specialists, so we can't provide any medical advice, but we can connect you with the right people. And that's our job, is to connect you with the right people. So if you have any type of question, whether it's how is Medicare billing this, or I need to talk to somebody about caregiver services, or I need to find out what this means when I need a hip replacement, then we can talk with you, and if we don't know the answer ourselves, we will find somebody who does.
Well, Amy, I think that is just a fantastic service. I understand a lot of these people are really volunteering to do some of this wonderful work. So your organization and the people in it are doing a wonderful job.
No, thank you.
And Amy, again, thanks for coming. We're going to be seeing you soon in our second half of this discussion, and that will be the world of business. Amy, again, thanks for coming. And for you out there, thanks for you coming. And I'm Bruce Harders. This is Voices in the Village. See you soon. Bye now.
Parkinson's disease is a neurological movement disorder affecting an estimated 1 million Americans, including many under age 40. It has no cure. Parkinson's is not limited to how a person moves. It can also cause symptoms like depression, fatigue, and impaired speech. Today, there is a new diagnosis every 9 minutes, though Parkinson's can be present for years before being diagnosed. The American Parkinson Disease Association is the largest grassroots network in the United States, working to help ease the burden and find the cure. For more than 50 years, APDA has funded pioneering research and provided critical support to those affected by Parkinson's. Visit apdaoptimism.org today to find out how you can help millions live with dignity and optimism. Your action today will help APDA put an end to Parkinson's disease.
Hello there, I'm Bruce Harders, and this is Voices in the Village. Today we're going to do part 2 of a 2-part interview with Amy Osman Cook. Amy, in our last meeting, we talked about the world of health and all the things that you do there. Today we're going to kind of lean over more into the business area. And by the way, welcome to Voices in the Village. Thanks for coming by.
Oh, thank you. Thank you so much for having me, Bruce. It's so fun to be here.
Great. We're glad to have you. So what's up? What's up, Amy? What's new?
Well, I am excited to talk about business. It's a passion of mine. I love the business of healthcare. I love healthcare in general. And I'm excited to learn more from you as well because you have a very extensive business background yourself. So I thought maybe what we could do was talk about a recent article in Forbes that I was featured in, if that works.
Absolutely.
We had talked about it before the show a little bit. And one thing that's pretty important to me is that I'm a mother of 5 children. And I love that more than anything. And I also love running my business.
Right.
Those are my 2 passions in life. And a lot of times people think that they're mutually exclusive. They feel like, well, you're a mom, so you can't be a good business owner.
Right.
And my point of the article in Forbes was that because I'm a mom, I can be a good business owner. There are so many different types of skills that transfer from one to the other.
Absolutely.
Do you agree?
I absolutely agree.
Yeah, especially in the field of management, I think, I manage my team members in some ways the way that I manage my children's schedules, for example.
Right.
And there are 4 kind of salient points that came out to me that
Sort of 4 rules to the road.
That's right, 4 rules to the road, if you will, on some ways that motherhood and management mesh, if you will.
Oh, I like that.
You like that? Okay.
Motherhood and
management.
It meshes.
It does. It meshes really well. So the first one is to find the right niche. So when you have a child, for example, Lizzie and Jenny, for example, they're my 8-year-old and my 7-year-old, and they both tried out for the Wizard of Oz. And Lizzie was Dorothy, and she was so excited to be Dorothy, and Jenny was the narrator, and she was so disappointed to be the narrator.
Yeah.
And one thing that I am realizing is that, Lizzie's talents are different from Jenny's talents. And Jenny has a natural affinity for dance, and Lizzie has a natural affinity for acting. And what I need to do, and as my job as a mother, is to set them on those paths where they are going to really excel. And sometimes it's not very convenient because I want to lump them all together and do just the same thing for everyone because it's easier.
As children, they're not going to have as broad a view as you do about things.
That's true too. That's a really great point. But I find the same thing that goes with my employees where, they are excellent people. And I hire people who are really smart and really great. And sometimes when you first have them in something, sometimes it takes them a while to develop a skill set, or sometimes they're in the wrong one. For example, there's one guy that I work with, let's call him Tom, and I tried putting him writing content. And he was okay, but not a great proofreader. I put him into PR, and he just went to town. I mean, he was so good at it.
Left brain, right brain.
Absolutely. And he loved talking so much more than writing. So it's really different. I mean, have you found that in your experiences with business?
Oh, absolutely. And some of the companies that I've been part of or know about, they seem to treat it one way or the other. They either, if you don't fit, square peg in a round hole, too bad, out the door. And then there are other companies that if they recognize a real talent in you, they'll find a place for you somewhere, just like you were talking about now. And certainly the best companies are the ones that value somebody who has great worth, but not in really the best role.
Yeah, that's a really great way to say that. So I hadn't really thought about that, but I have experienced that as an employee myself, being in that kind of an organization where if you don't fit in that peg, you're out,
Right.
and they'll find somebody who does fit in that peg.
Well, I think too the problem is that most people can't afford to have the ability to move people around. So they hire somebody and they think this person can fit. They're kind of making it fit because they haven't found anybody yet and they need to fill a job. And then after 3 months, 6 months, they realize it didn't work and they have to show them to the door. There's a lot of expediency that goes on in the business world where something has to be done, a hole has to be filled, and we kind of talk ourselves into something when in a way we really know it's not going to work out.
That's a really great point too. And so I guess the difference between motherhood and management are you're already going to think your kids are really awesome and bright with tons of value, right? Where you might not think so with an employee
Well,
originally.
of course, the difference too is that as a mother, you know exactly what their interests and what their capabilities are.
That's true too.
And the boss doesn't always realize that, doesn't spend enough time figuring that out.
Yeah, that's very true. very good points. So the second one is making decisions with deliberation. And your expediency point, I think, is very valuable here because I try to make sure that I make decisions with deliberation. One example is I wasn't sure whether I wanted to hire someone, and he was kind of bugging me a little bit. And I asked him to do something, and he said no. And I'm like, why would you do that? Why, when you're looking for a full-time
Trying
job
to sell
here,
yourself.
yeah, why would you do that? And so, I thought, well, I'm not going to make a snap judgment. Let me give him a project on a part-time basis and see how he does. And we ended up having a great conversation, and he said, I'm 100% committed. I'm 100% willing to develop my skill set. I'm so excited. He completely did a 180 from my perspective.
Right.
And maybe it was a misunderstanding on my part. So I think if we can make decisions with deliberation as managers, it serves us well because then we don't make snap judgments that can be wrong as often.
So being deliberate about something, that you've got your mind made up, you're going to be very deliberate about it, and you're going to get it done. Is that
Yes,
it?
that's it. And then also not rushing to judgments. But with what you were saying as far as expediency goes, sometimes you have to.
Right.
You know,
right.
so there's always that back
Well,
and forth there.
that's why the niche and the deliberation go hand in hand. One is not good without the other.
That's exactly right. So some of your background, I know that you were the VP of Business Development for a
Right.
very large company.
Right.
And then you also, can you tell me a little bit more about Toshiba and what you did for them?
Well, in that case, I was the general manager of their telecommunications division, where we were building a business nationwide with a product that really hadn't been out in the marketplace before. And so the great fun of that was working with the Japanese and learning about how some of these big companies work in Japan and other places. So
A lot of fun.
It was a lot of fun, and we had some really good people in it. So that was a fantastic experience.
Oh, that's really great, and learned a lot of valuable management lessons
Well,
as well.
the thing too is when you're in a career, you're growing yourself.
Yeah.
You're getting older and growing yourself. So it's good that we do that, because if we sat in one spot, it wouldn't do very well.
I think about myself as a 23-year-old first getting into business and think, oh, I knew nothing. And I still know nothing, but I knew even less than I did before.
Well, yeah, I mean, you never can, I mean, you're right, you can never learn it all. There is so much out there. All you can do is really manage and know what you're in charge of and what you're responsible for.
Yeah,
And don't
that's
worry
right.
about the fact that you don't know how to land a man on the moon or whatever.
Right, exactly. Well, so the third point of this article was to set your expectations high. And I do that for my own children. And one thing that my mom told me was, it's going to be hard to figure out exactly what those expectations should be for your kids because everyone's different. But I do know that if you don't set your expectations high, they will never meet them. They will only meet the expectations that you set for them. And so I think about that in terms of, trying to be very supportive as a manager, but also set the expectations high. And don't be afraid to send stuff back and say, try again, because I know you can do better.
Well, I think in the business world that's very important, because if your boss says to you, I really have high expectations for you. I don't mean to scare you, you understand, but I just know you've got the capabilities to do that. And then as time goes by, if they keep referencing that point, see, I told you I expected that from you. That's about the most wonderful thing that could happen to an employee, and unfortunately seldom does.
That is really a great perspective, because I had not really thought about, revisiting that, like in performance evaluations or even just in conversations,
Right.
saying, I knew you could do that. I told you could do that. And that's an expectation that I had for you.
Well, the other problem too, that there are so-called points of time where they have to do a analysis of your work. And some of the worst things that happen in a business is somebody writing a bad appraisal. Appraisals. It's a lot of companies are doing less and less on formal appraisals. But I've seen so many appraisals that were just skewed so that it could reflect what the boss felt, regardless of what really happened in the world. So
That's really tough.
it's a tough area.
That's a very tough area. And the fourth and last one is making people better than yourself by empowering them to grow.
Now that takes a lot of a broad, you have to really feel good about yourself.
I was just going to say the exact same thing. When business owners are insecure, then this doesn't happen very often.
No, it doesn't
Don't
happen.
you agree?
No.
But what should happen is a secure business owner should say, listen, our company is so awesome, but nobody can know it all. So I'm going to hire people who are better than I am in these areas so we can flourish and grow and build something better than we are.
Well, that idea is rampant in business. In the best of businesses, at the very top, people, somebody will say, "Why? How come you're so successful?" And they say, "I hire people that are better than I am."
Mm-hmm.
And don't hire somebody who is good as you, or a little less good. Hire somebody better than you.
Yes, exactly.
Well, I think we've come along to the very end of our discussion. Where does time go when we're talking?
That went really fast.
Having a good time. Well, Amy,
Yes.
again, thanks for coming by for
Thank
your
you.
third appointment and
I am
interview.
so lucky to be here for the third time.
We're lucky. We're lucky to have you. And for you out there, thanks for coming by. I'm Bruce Harders, and this has been Voices in the Village. Bye now.